So I just want to introduce the synchronous session assignments as far as what we're going to be doing with them, what they mean, and how to go about completing those. So basically, if you read the description in the syllabus, and I've repeated it here as well, and this synchronous session assignment sheet is available for you on Moodle as well. Basically, the purpose of these are to describe and to discuss some of the differential diagnosis and treatments and protocols associated with injuries. And so we're going to spend some time emphasizing clinical decision making from a very practical injury-based focus. And so these sessions and assignments will take place in 3 parts. Prior to the session, there will be worksheets available for you on Moodle underneath the assignment, and these will be from the Trailmaker's Guide to Anatomy, and basically will give you an opportunity to familiarize yourself or refamiliarize yourself with the anatomy of the area that we're talking about. One of the advantages of this as well is, since we're entering in board season, all the anatomy pictures that the Board of Certification uses for the exam come from this Trailmaker's Guide. So if nothing else, it will help you identify some of the pictures that you might see on your boards. But the idea is all good clinical decision making starts with a strong emphasis in the knowledge of the individual clinician. And when we're talking about injuries, that is first and foremost the knowledge of anatomy. Then during the session, what will end up happening is we will go through some of these major injuries, discuss them as a group. So it's expected that you'll be an active participant in these discussions regarding either your own experiences with these injuries, different things that you've known or seen, or tips and tricks, as well as any questions you might have. The purpose of doing these live is so that there can be good interaction between yourself and the instructor, as well as your fellow students. And in order for that to occur, you have to be an active participant. And then after the session, you're going to have another brief assignment to do to kind of wrap up what we've discussed. The first thing that you will do is you'll do a very brief, maybe 3 sentences or just a few bullet points, whichever works best for you, discussing kind of the main points with each injury and the basic plan of care. Basically just giving yourself some time to reflect on that injury, how you remember it. Maybe it's the differential diagnosis that was particularly interesting to you. Maybe it was some of the discussion on plan of care or special tests. Whatever was most noteworthy to you, jot that down. And then, since the rehabilitation plan is more patient and goal focused opposed to injury focused, for each of the goals of rehabilitation or phases of rehabilitation using this Hoagland model here, right? Flexibility, range of motion, strength and endurance, balance and coordination, function, and then performance. You're going to describe at least 2 exercises that could be completed in each of these phases in the care of any of these injuries. So there are 5 phases that are listed in this pyramid, and so you would describe at least 10 condition or 10 activities or exercises. And then lastly, I ask that you find at least 1 post-surgical protocol, and you'll attach this to your assignment as well, and then give basically some highlights, a critique of that, anything that you find of interest. And so you can then combine all of these into 1 file if you would like, or you can upload multiple files to the Dropbox for that. And so for the worksheets, the prior to, you can handwrite that. If you want, oftentimes it'll call for coloring, and you don't have to color if that doesn't help you, but it definitely helps reinforce specifically muscles, locations, origins, insertions, that thing. And so you can either scan that or just take a picture with it of the worksheets with your phone and upload that together, as well as then uploading your document and your post-surgical protocol. Thanks.